States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm Dr. Ed Weiner, Chairman of the Burlington Board of Health, and with me this evening are board members Andrea Sheehan, Mary Beth Welch, Gail Demore. Our Vice Chair, David McSweeney, had a work commitment this evening out of state. Also with us this evening is Susan Luminello, our Director of Public Health, Michael Green, Associate Director of Public Health, Environmental Engineer Christine Mathis, and Health Agent Marlene Johnson. We do not have a recording secretary this evening.
No, we're recording it for her.
Thank you. Please know we're live on and will tape by BCAT and available for appropriate comments and questions through this video technology. We're also having some problems with our WebEx tonight, so if you're on BCAT and you couldn't get on WebEx, it's because we're having some technical difficulty this evening. Thank you for BCAT, as always, for what you do for this community, keeping us all aware, so well informed in this community. People ask me, why do I mention that we're live on and taped by BCAT, and that is, it is mandatory that I note that at the beginning of every meeting. Which now brings us to approval of minutes, and let me see what we have tonight for approval of minutes. We have a couple. We have August 22nd approval of minutes. Would you please, if you have not taken a look at them, and we're looking for a motion to approve those minutes.
So moved. Second.
Motion by, was that Andrea? Second by?
Second.
Vice Miguel. Any corrections, omissions, comments, discussion? If not, I'll put that to a vote. All in favor?
Yeah.
Aye.
Aye.
Oppose? Okay. Are there any abstentions? No. Okay. We also have minutes for October 24th, 2023. Do I have a motion to approve?
Motion to approve.
I have a motion to approve. Do I have a second?
Second.
I have a second by Gail. All in favor? Aye.
Abstain.
Oppose?
Abstain.
An abstention by Mary Beth. 3-0-1. Thank you so much. Which brings us to citizens' time. Is there anybody here who is not on the agenda who'd like to speak to this board? They're both on the agenda. Is there anybody online at BCAT? No, there isn't. Okay. So we'll move on to Chairman's report. Recently, the Burlington Board of Health, in association with its Volunteer Reserve Corps, hosted a program on overdose and the use of Narcan. Associate Director Michael Green coordinated that. It was a fabulous program. Thank you very much, Mr. Green. We are not experts on mental health. We're not experts on its treatment or overdose, and I want to emphasize we're not experts. But I want to pass along some information that came from Florida Atlantic University that I researched after that program. From 1999 to 2020, those 20 years, there have been over 1 million deaths due to overdose in this country. That's 4.4 times increase of drug overdose deaths in that time period. In 1999, there were 6.9 deaths per 100,000 in the population, and in 2010, there were 13.4 deaths per 100,000, and in 2020, there were 30 deaths per 100,000. This is a public health epidemic. We all need to learn more about mental health, the abuse of drugs and overdose, and more to come, I hope, as we learn about this issue. And don't forget, You can always call 911 for mental health and all emergencies. And all emergencies, call 911. And if you're struggling and you want to talk, you can always use the new 988 Suicide and Crisis Lifeline. Again, it's 988. It's being advertised now, and it's very important. I'll ask Mr. Green, shall I add anything to this? Have I covered it? What do you think from what we learned last week?
You can buy Narcan to address those opiate overdoses over the counter at some drugstores. So if that is an issue, make sure you're prepared before an event happens.
Thank you. Any other comments? If not, we'll move on to subcommittee reports. I think there are none this evening. And variance, American Food Vending, 78 Blanchard Road, unattended food establishment.
Yes.
Would you please come up?
Yes.
Marlene, does he need to sign in?
Yes.
Is there a sign in there?
There is not.
No, there is not.
Give us any paper?
Marlene Johnson, our health agent, will be bringing up and presenting this evening.
Here you go. Please just super efficient. Your name
Sir.
Yeah.
and your
Yeah.
affiliation. You
Please print your name and your company, please. This will be for the recording secretary.
You can leave that there. Thank you. And you can have a seat, Steve.
Okay, thank you.
And your name, please? for the-
Stephen Chaff?
I'm sorry?
Stephen Chaff,
CHAF?
C-H-A-F-F.
Thank you.
So Stephen Chaff is here representing American Vending Services, and they are interested in operating an unattended food establishment at 78 Blanchard Road. And just for the record, an unattended food establishment is an operation typically located in office buildings or restricted break areas where access by the general public is somewhat restricted. These operations frequently offer packaged time temperature control for safety foods and non-temperature controlled for safety foods that are displayed in the refrigerator unit, freezer unit, food racks, baskets, and/or countertop display units. Unattended food establishments may also be equipped with microwave ovens or offer automatically dispensed hot and cold beverages. And the one common characteristic of these operations is that they lack the presence of an on-site person in charge. So the variance representatives would like to receive from the Board of Health is from 105 CMRF 590.003, which is also the Food Code, Chapter 2, 10111, which requires a person in charge to be present at the food establishment during all hours of operation. So I know the board is familiar with these operations. The same level of protection, the Massachusetts Department of Public Health Food Protection Program provides a guidance document for unattended food establishments prepared by the Conference for Food Protection. This document was provided to the food establishment noted above to establish a written food safety plan for the unattended food establishment. I have reviewed and approved their written plan. It's also included in this paperwork. By following the procedures outlined in their plan, the same level of protection can be achieved. So action by the Board of Health. Vote yes to approve the unattended food establishment variance for American Food Vending, operating a micro market at 78 Blanchard Road with the following conditions. And there are 5 of them. This food establishment shall follow their approved written plan for minimum requirements for an unattended food establishment. This variance is for the location noted above. Any additional proposed unattended food establishments within the town of Burlington will require a separate written plan and variance. So if American food vending, Stephen wanted to operate another location, you need a separate variance
Correct.
and written plan for that. Violations of this variance may result in an appearance before the Board of Health and may result in a temporary suspension of the food permit. Continued violations may result in the revocation of the variance by the Board of Health. In the event of an imminent or threat of a health hazard, the Board of Health may suspend the permit without a prior hearing as outlined in 105 CMR 590.014A. And 5 should read, the food establishment manager shall notify the Burlington Board of Health within 24 hours if there was an imminent health hazard, food tampering, and/or a food injury. Or the board may vote no and not approve the variance.
Have you seen these conditions?
Yes.
Do you have any problem with any of these conditions? Then I will ask, does anybody have any questions for the proponent? I just have one under section number F, 1B. It says, "The single-cup brewer is cleaned and sanitized when filled daily. This includes the brewer, mixing bowls, water product lines, and the exterior of the unit." That will be done every day, is that correct?
Every day we are there to fill. There are some days that we are not there to fill, such as, holidays or whatnot, but every day we are there, which is typically 5 days a week. Not there on Saturdays or Sundays. The office building is open on Saturdays with a very limited staff.
So the question is then to our health agent, is that acceptable?
Yes, it is a single-cup brewer, so it's sort of like a Keurig, that type of an operation, so that is acceptable.
You acceptable to you?
Yes.
Okay. I have no other questions, except I would be very careful and I would abide by these conditions because she may sound very professional, and she is, but she can be very draconian.
She's been very helpful.
Well, that's very nice, as she always has been for decades. Thank you so much.
Thank you.
Do I have a motion to approve, please?
So moved.
I have a motion by, so I have a motion, and let me just make sure I get this right here. That was from Ms. Welch. A motion by Ms. Welch, second by Andrea Sheehan. All in favor? Aye. You're all set?
Thank you very much, everyone. Marlene, thank you very much.
Arlene, do you have to send them something?
Yes, I'll email it to you tomorrow, and you'll get a hard copy.
Excellent. I appreciate it.
Okay, thank you.
Okay. Which brings us to our next, 1 Jackson Road, keeping of animals, hens. Please come forward. And please sign in, print your name. What is your name, please?
Robert Haven, Haven.
Do you need a pen?
Yes, please, I'm sorry.
It's okay. Thanks.
So Robert Haven is here. He's a resident at 1 Jackson Road, and he is looking for approval from the board for a permit for 6 hens. An inspection was conducted by Samantha Hardy, our associate health inspector, on October 25th. The following were found to be in compliance with the Burlington Board of Health minimum standards for the keeping of animals regulation. The chicken coop design had proper square footage per hen, proper ventilation and setbacks were met. Manure management plan does not cause a nuisance. Turf management plan, reseeding grass if needed. Feed storage plan does not attract pests. Action by the Board of Health. The Board of Health may vote yes to approve the keeping of animals permit for 6 hens for Robert Haven at 1 Jackson Road with the following conditions. Notify the Board of Health in advance before increasing the number of hens. Do not purchase or acquire a rooster or cockerels. Renew the keeping of animals permit 30 days before the expiration date. Allow the associate health inspector to schedule and conduct an annual compliance inspection. This permit is approved for applicants noted above and is non-transferable, and violations of this permit may be subject to penalties as noted under Section 9 of the Burlington Board of Health minimum standards for keeping of animals. Or the board may vote no and not approve the keeping of animals permit.
Why do you want chickens?
Cost of eggs, I eat a lot of eggs. And it's actually good for you. And it's, we got them originally for our kids. You know, they're 2 and coming up on 5. And, you know, you get, like, food scarcity is a real thing. And, you know, you got to take it back to the basics, you know. Plus, you know, they can grow up and take care of them themselves. It's food, you know. You can't get, you know, closer to, you know, farm to table than going out and caring for them.
And then the other, you saw the conditions, you have any
did,
problem with
yeah.
the conditions?
No problem whatsoever.
And then the other questions, were there any, to Ms. Johnson, were there any, anybody who responded to the abutters?
No, they all
Any of the abutters, please come forward. There's nobody
They
here.
all were notified.
They all were
and we
notified,
didn't
no
receive-
problems.
We didn't receive any comments.
A lot of them called me. They're like, what's this? And I was like, yeah. So we originally got 6 chickens. I'm sorry, 4 chickens, and one of them turned out to be a rooster. And I was very hesitant to admit it because, you know, I read a whole bunch of stuff that, you know, when you got all females, then one of them can act, you know, and crow. But yeah, no, he crowed all the time. We had to get rid of him. So.
Any questions for Mr. Haven? Do I have a motion, please?
So moved.
We'll do Ms. Demore first. Second by, was it Ms. Welch? Any other discussion? All in favor? Aye. We wish you well.
Thank you.
Very good.
They taste so much better too.
With the chickens or the eggs?
No, the eggs. I gotta get to the point where we can eat the chickens. My wife's and kids are against it, and I was like, you gotta stop naming them.
Be well. Thanks for coming.
Have a great one.
Good night.
Which brings us to staff reports, health agent. Ms. Johnson, Marlene, any-
Sure. Good evening. So the Taste of Burlington event, Samantha and I both conducted our inspections there. There were 24 food establishments that were there, and we had no issues. Everybody was doing a great job. We took temperatures and made sure that everybody was ready for the event. And I was also part of a norovirus discussion with some other folks who worked for health departments, boards of health, and it was with the Association of Food and Drug Officials. And the discussion was about what we feel that's needed as far as communicating to restaurant management to be able to ensure that they understand norovirus, how serious it is as far as making sure that employees don't come into work sick, and because norovirus is easily spread. And they're going to try and work on putting together a presentation that can be shared throughout the country, which would be excellent, because it's always nice to have something that's already out there that you can use to do some training with the persons in charge. So I really, I got a lot of information out of there, and it was nice to talk to some other folks. I talked to somebody from Las Vegas, Nevada, who had some really good suggestions how he handles education and training in his state, so it was good. Are there any questions on my report?
Anybody? I just had one question about the Jennifer W. Winchester, Board of Health, Plan Review Protocol.
So she was looking to redo her plan review,
Okay.
and so she wanted to know how we do it here, so.
I know you're a great resource. Thank you.
You're welcome.
I have no other questions. Do I have a motion to approve?
So moved.
I have a motion by Ms. Welsh, second by Ms. Demore. All in favor?
Aye.
400. Okay, brings us to the environmental engineer. Ms. Mathis.
I just wanted to highlight that we made an adjustment to our Sharps collection program, and that we we established contact with a new vendor because we were having issues with proper timing on pickups with our old vendor. And we also wanted to increase the frequency of pickups because we're down to the one collection kiosk in the fire department lobby, as the one in the police station is no longer there. So that's been put into place, and so far, a couple of weeks in, it's going well.
Beautiful. Any questions for the environmental engineer? Did you award the technical assistance grant to geoengineers?
We did, over the summer, we awarded that, and we had a kickoff meeting with them, I think, back in July, and they submitted their draft report at the end of September. Susan and I had a meeting with them last month to go over the draft report, which they'll incorporate some of our comments, come back with a final draft in December, and then that'll be ready for presentation at a board meeting in January, followed by the public meeting in February.
And you will present that, or they will present that?
They will.
Okay, good. Any other questions? I have just one more. The Broward Institute, Biological Safety Permitting, was that a meeting, or is that, where are we with them? It's really exciting that they're coming to town.
Yeah, so they're, the Broad Institute, they're moving their Human Genome Project to Burlington, and we're just beginning the discussions with them about biosafety permitting, reviewing protocols and stuff like that. It was just a few initial emails and phone calls back and forth to familiarize their biosafety officer with the regulations in Burlington, and we'll have some more discussions with them over the next few weeks. I think they're looking to, we'll probably get a permit application from them around the beginning of the year, and I think they're looking to have occupancy at 25/27 Blue Sky Drive, late summer 2024.
And that's up on the hill. You can see it.
Can't miss that building.
Can't miss it, though. And as you know, the Broward Institute is it's a company or an organization, or it's a nonprofit. I'm not sure exactly how that, but we can ask at that point, but it's MIT and Harvard associated biotechnology institute, and one of the most famous in the world, and they're coming to town. And it's very exciting that they have chosen this community.
Yes.
Any other questions for the environmental engineer?
I'm just curious on the Archer Hotel previous hazardous material registration.
So when we changed from the hazardous materials bylaw to the hazardous materials regulations, we made some exemptions for permitting, one of which were entities that were, they were only on the hazardous materials review list because of pool chemicals. And since we already, Marlene and Sam already inspect pools under the pool program and pool permitting, we've decided that we could streamline there. So Archer was on, now they're not.
Got it. Perfect. Thank you.
Do I have a motion to approve the environmental engineer's report? Motion by Ms. Demore, second by? Second by Ms. Sheehan. All in favor?
Aye.
Aye, 400, which brings us to the Associate Director of Public Health. Mr. Green.
Good evening, Board. I'd like to bring to your attention our Our next BVRC quarterly meeting is on December 6th. In addition to light refreshments for volunteers and interested residents of Burlington, we're going to have Dr. David Schwartz do a presentation on emergency pet preparedness measures and pet sheltering. That should be a very entertaining and informative presentation. And then a week after that, on the 13th, we have our BVRC Appreciation Dinner. So we're going to kind of highlight everyone who volunteered for the BVRC this year and give them a nice dinner and give them some good entertainment.
And everybody's invited, please, from the board, please consider it. It's always a wonderful evening. Any questions? I have a couple. First, I want to note to you how terrific the Narcan training was, and thank you very much for putting that together. I know that you have a handle on all of those trainings for the VVRC. You've done so many of those trainings this year. I know that our director has given you that responsibility. Thank you, and you're doing a terrific job doing them. I've been to most of them, and they've all been terrific. And I also want to note that you are involved in the Suffolk Leadership Training Program and the Management Academy, and I just want to acknowledge that. I know it's a lot of work on top of what you do for this community, and so I just want to note that for the community, that you are actively learning from both of these academies and from our staff. We're all experts. Any other questions? If not, can I have a motion to approve the Associate Director of Public Health report?
So moved.
Motion by Ms. Welsh, second by
Second.
Ms. Sheehan. All in favor?
Aye.
Aye. Which brings us to the Director of Public Health, which I'm going to add to that, as I usually do, the Associate Health Inspector's report, and we'll do that in conjunction with both our Director and with input from our health agent. Does anybody have any questions? No, this came up under Samantha Hardy. She had 8 routine keeping of animals inspections, and I got this call the other day, and maybe it's a good time for you, just either of you to review this. We had a chicken permit today. The Board of Health does go back, and we do inspect once a year. Is that correct? And any other times unless there's a complaint, but at least once a year. That's what I told them. If there are no questions, we'll go on to the Director of Public Health. And before she updates us, Susan is in the office all the time. If during the day you need to speak to her, please give her a call. You're there. You're also there on Wednesday evenings if you need a quick update. Susan is always there. Not only, I think our staff, our board knows, our staff knows, but just to make sure that the community knows that you are there from anybody who wants to talk to. I try to get up 2 or 3 times a week so you can tell me to sit. And so, with that, do you want to update us on anything?
Sure. We're continuing with the vaccination clinics with the uninsured children at the schools. We had one yesterday at Francis Wyman School that went really well. We have one next Monday at Memorial School. Then on the 1st, we have one at the high school, and then we're scheduling one December 11th at the Board of Health office. So I think by the time that December 11th comes, hopefully, we'll get past the backlog, I guess, of all the students that currently are unvaccinated, and then we'll just be dealing with new students or students who need second vaccinations and still have not been able to get insurance. So I'm thinking of maybe just doing it on a monthly basis and having like a monthly clinic and adding students into that clinic, whoever kind of comes up, because we get the records kind of intermittently, they don't all come at once, so we can fit in a student on a scheduled time if we have it ahead of time. So we're working on that. I'm finding that, actually, the Vaccine for Children program has been great. We're getting the vaccine in a timely basis. We've ordered a lot of vaccine, and I've had to order more, because once someone gets a vaccine, 2 months may come by and go along, and then it's time for the second dose of a vaccine that they've already received, so now we have to give the second dose or the third dose. So it's ever-changing, so spending some time keeping track of that and ordering and making sure everything gets into the state system. So that's where we're at that. I'm hoping that, like I said, by the beginning of next year, that will wind down. And Barbara Conley, the lead nurse at the schools, has been great as well. So we're working very closely with her.
That's good.
Continuing to work on the new software for the department, trying to get that up and running. That's under the grant that we're getting that, and Mike and I are going to begin trying to configure. We've all got all the food programs configured. Now we're going to start working on the other programs and start configuring different modules in the software. So we're working on that as well. And then continuing with the codification of the regulations, which kind of goes along with that. I'm still working on that. I'm hoping to get that to the board by January.
Thank you. Questions for...
We also have the budget coming up.
That's what I'm going to talk to you about
Susan,
tomorrow.
that BHS exchange student vaccination status. What's exchange student
So
status?
I was contacted by an exchange student at the high school needing a vaccination. So
Didn't they have to have that before they were accepted into that program?
that is like, I don't know, I
Yeah, I
don't know
just
the
brought that
rules
up.
of that. I
Yeah.
think that I don't know if the person slipped by or
Okay.
some school or whatever. But she had contacted me directly. It wasn't the school that contacted me. And so I had to go to the Vaccine for Children program and find out if, we could even vaccinate someone that's an exchange student, and we cannot. We can't. So I just found out today, actually, from them that we cannot vaccinate them under the Vaccine for Children program if they don't have insurance, which they're supposed to have insurance, but if they don't have it, or she said she had it, but it didn't pay for vaccines, which is very common, I guess, now. But so they're considered underinsured. So in that event, they have to go to a federal community health clinic to get the vaccination, and there is one in Lynn that I referred her to, so.
Okay, thank you.
Any other questions?
I just had a quick question. Can you speak to the possible intern?
Yeah, so that was someone through UMass Lowell who contacted me looking for an internship for next semester.
Okay.
So I'm hoping that they start, they'll start probably like end of January and help out with the health fair.
Oh, okay, cool.
Burlington Square, 111 Middlesex Turnpike. We got a report. They did do what they were supposed to do, and it hasn't helped.
I haven't been, I don't know if you've been there recently. I have not, so I'm not sure what the...
Well, I think we need to decide at some point what we're going to do.
They're coming in April.
I understand April, but during the winter, it could be a very dangerous situation there. And I don't know what we're going to do, but we can talk about that tomorrow, too. I think that we should do some type of at least an inspection, a formal inspection. I know they sent out a report saying that it's the town's fault, and it's not their fault, but if need be, we need to get together with DPW and decide what we're going to do, because if it ices up this winter, it could be pretty bad there. So I think that if you have an opportunity the next week or two, if you could drive by there and take a look, or maybe delegate it to to one of your other professionals and have some type of report to the board, because we have to, I continue to worry that someone is going to get killed there, either driving or falling or whatever. And if we have to do something there as a nuisance, as part of a nuisance violation, we need to at least know what we're talking about. So if you can get over there, I'd really appreciate it. And I urge the board members to drive by what's opposite there, over there by Staples. Oh, it's not Staples parking lot, but
Yeah.
Duluth training.
Duluth Training, thank you, Duluth Training. I love their clothes. Duluth Training, and just take a look at the,
So if we go out and we look and we see, oh yeah, it's still a problem, do you want to ask them to come before the board again?
sooner than later, absolutely.
Yeah.
But I will, yield to your judgment. Take a look at that. Because if it's necessary, we have to close off that part of the parking lot or leave up the barriers or just whatever we do. I think we've spent a lot of time on this, tremendous amount of time, and if it's still the same after they spent a lot of money, we're responsible for the safety of this community. Simple as that. Last question is, for our next meeting, when is the cutoff date for agenda items?
For agenda items?
Before or after Thanksgiving?
So I guess, our next meeting is,
2 weeks from today.
Is that not on the list?
28th.
Well, no, it'd actually be the 28th.
The 28th.
November, that's an extra week.
yeah, so let me,
Thanksgiving's early.
right, so it would be the 28th, so because of the holiday.
That's why I'm asking.
Yeah, so the agenda would need to be posted earlier if we had it, so that would be, because the holiday really is 2 days, so that would actually be, like, I think, I'm not positive, but we would count Monday, so maybe Tuesday, the 21st.
So that's a week from today.
Right, and right now, we don't have any items on the agenda.
Okay, that's what I wanted to know. If you had any items, I'll ask the other professionals now. You have nothing?
Nothing, no.
Nothing, okay. All right, very good. Any other questions? If not, can I have a motion, please, for the Director of Public Health's report, which includes the Associate Health Inspector's report? Motion by Ms. Sheehan, second by Ms. Welch. All in favor?
Aye.
Aye, 400. Anything else this evening? If not, motion to adjourn. Do I have a motion?
Motion to adjourn.
By Ms. Sheehan, second by?
Second.
Second by Ms. Demore. All in favor?
Aye.
On behalf of the Board of Health, we wish you a happy and a healthy Thanksgiving. Be with family, enjoy, and thank the Almighty for everything that you have in this wonderful country. Good night, everybody.